The biopsychosocial model is a way of understanding mental health that goes beyond simply looking at the brain. It recognizes that our mental well-being is influenced by a complex interplay of biological, psychological, and social factors. Imagine a three-legged stool, each leg representing one of these factors. If one leg is weak, the entire stool becomes unstable. This model emerged in the late 20th century as a response to the limitations of purely biological approaches to mental illness. It challenged the notion that mental disorders were solely caused by chemical imbalances or genetic predispositions. Instead, it argued that social factors like poverty, discrimination, and lack of support could also contribute to mental health issues. The biopsychosocial model emphasizes the interconnectedness of these factors. For instance, a genetic predisposition to anxiety might make someone more vulnerable to stress, which can then be exacerbated by social isolation or job insecurity. This model encourages us to see mental health through a wider lens, recognizing the intricate web of influences that shape our well-being. One of the key strengths of the biopsychosocial model is its comprehensive framework. It encourages healthcare providers to look beyond symptoms and consider the whole person. This means taking into account their medical history, lifestyle, personality, social support network, and cultural background. This holistic approach fosters a more empathetic and individualized approach to care. It recognizes that each person's experience of mental illness is unique, and that treatment plans should be tailored accordingly. By addressing the interplay of biological, psychological, and social factors, the model aims to provide more effective and sustainable solutions for mental health challenges. Despite its merits, the biopsychosocial model has also faced criticism. One common concern is its lack of clarity in defining the relative importance of each factor. Critics argue that the model doesn't provide clear guidelines on how to weigh these influences when making diagnoses or treatment decisions. Another criticism is the model's resource intensity. Assessing and addressing all three domains can be time-consuming and costly, requiring a multidisciplinary team of professionals. This can pose challenges in healthcare systems that are often stretched thin and prioritize efficiency. While the biopsychosocial model is widely accepted in theory, its practical implementation can be challenging. Real-world constraints often make it difficult to fully embrace its holistic principles. For example, time limitations during appointments may prevent healthcare providers from delving deeply into all aspects of a patient's life. Additionally, a lack of coordination between different healthcare providers can lead to fragmented care that fails to address the interconnectedness of biological, psychological, and social factors. Section 5. Integrated care systems, a path to better implementation. One way to improve the implementation of the biopsychosocial model is through integrated care systems. These systems aim to break down silos between different healthcare providers, fostering collaboration and communication. In an integrated system, a patient's primary care physician, therapist, and psychiatrist would work together, sharing information and coordinating care plans. This would ensure that all aspects of the patient's well-being are considered and addressed in a coordinated manner. Section 6. Holistic assessments, painting the full picture. Another crucial aspect of effective implementation is the use of holistic assessments. Unlike traditional assessments that focus primarily on symptoms, holistic assessments aim to gather information about all three domains of the biopsychosocial model. This might involve asking questions about the patient's medical history, family background, social support network, stress levels, coping mechanisms, and cultural beliefs. By gathering this comprehensive information, healthcare providers can develop a more nuanced understanding of the individual's needs and tailor interventions accordingly. Section 7. Depression and schizophrenia. Through the biopsychosocial lens, let's consider how the biopsychosocial model can be applied to specific mental health conditions like depression and schizophrenia. In the case of depression, the model would consider factors like genetic predisposition, neurotransmitter imbalances, biological, negative thought patterns, and stressful life events, psychological, as well as social isolation and lack of support, social. Treatment might involve a combination of medication, therapy, and social support interventions. For schizophrenia, the model acknowledges the role of genetics and brain abnormalities, biological, while also considering the impact of family dynamics, trauma, and substance use, psychological, as well as stigma, discrimination, and access to resources, social. Treatment often involves a combination of antipsychotic medication, therapy, and social skills training. Section 8. The future of the biopsychosocial model, embracing progress. The biopsychosocial model remains a work in progress, but its potential to revolutionize mental health care is undeniable. As we continue to unravel the complexities of the brain and gain a deeper understanding of the interplay between biological, psychological, and social factors, we can refine and improve the model's application. Advancements in technology such as telehealth platforms and data analytics offer exciting possibilities for enhancing integrated care and personalizing treatment plans. By embracing these advancements and continuing to advocate for a more holistic approach to mental health, we can strive to create a future where everyone has access to the care they need to thrive. Section 9. Conclusion. A call to reflection and action. The biopsychosocial model, while not without its limitations, offers a valuable framework for understanding and addressing the complexities of mental health. By embracing its principles of comprehensiveness, collaboration, and person-centered care, we can work towards creating a more just and compassionate mental health care system. As we move forward, it's essential to reflect on the model's strengths and weaknesses, striving to bridge the gap between theory and practice. By engaging in open dialogue, challenging existing paradigms, and advocating for policies that support holistic care, we can collectively shape the future of mental health.